Welcome back. So it was 5 years ago today, the World Health Organization declared COVID-19 a global pandemic.
On the same day the stock market plunged, President Trump banned travel from Europe, and the NBA suspended its season, all due to the coronavirus. Some are still living with the infection. Actually, nearly 7% of people who contracted the virus have experienced what's called long COVID. That's when someone gets those symptoms for months, sometimes even years. We still don't have an approved treatment for long COVID, or really even a simple way to test for it.
NBC News medical contributor Dr. Torres joins us now with more on this. Let's start right there with long COVID. What are the symptoms of it? And so many people still dealing with it.
And that part of the problem with long COVID is the symptoms vary person to person, and there's a variety of symptoms. And essentially, it's 3 months after getting COVID. If you still have these symptoms, you can see here, then you probably have long COVID. You want to get checked out. And it could be anything from difficulty breathing, fatigue, migraines, headaches, joint muscle pains. The problem is the symptoms aren't very specific. They're very diffuse symptoms. And so people sometimes sit around for months and months going, something just doesn't feel right. Could this be long COVID? And those are the people that definitely need to get looked into.
We said that as of now, anyway, there's no way that we know of to just cure this, but what's the best way to treat it?
So there's no way to cure it. We have no specific treatment. So they treat the symptoms and they look at what's going on. And part of that also has to do with mental health treatment, like, as in, let's see if we can get you to live with what you have right now, because we don't know how long you're going to have this going forward. There's a lot of research going on, and that research is hopefully going to be pinpointing some symptoms. But the research, honestly, has been lacking over the last 5 years because it's a new thing, something we didn't really know about. Just trying to catch up to it right now, including the government as well.
So 5 years ago today, we didn't really know what social distancing was. We were debating over whether we were supposed to wear masks, and we were quickly figuring out how to work from home. So as we sit here today, are we better prepared for the next pandemic? What did we learn?
I think we are better prepared, and there are certain things we learned during the pandemic. Remember flattening the curve. Remember that. Remember the Diamond Princess, the cruise ship that had to go port to port, couldn't go anywhere because they didn't know how to handle it. Well, I think we've learned how to handle things, but I know that we found out pandemic after pandemic that our memory is very short, and we're getting into that time period where we're starting to forget those lessons. And so I think the important thing is not just for us, but for the government and civilian entities and everybody to remember that lesson, the lessons we learned, and say, let's go back and make sure that those lessons are beefed up. And sure, do we do everything right? No, we didn't do 100% right. So let's figure out the right things we did. Let's figure out the things we didn't do quite as correctly and make sure moving forward, when this happens again, not if, but when this happens again, we're ready.
Doctor, also could I ask about vaccines? Two things here. The breakthrough that an mRNA vaccine was, and how COVID essentially kind of like sped up the production and the use of a vaccine like that, but also the vaccine skepticism that's sort of kind of taken root here post-COVID.
And unfortunately, those two went hand in hand. We had this vaccine come out. It was amazing how quickly they came out with the vaccine. But when you look at it, it was actually 10 years of research that caught up to the pandemic. And then in the pandemic, it was just that perfect timing of being able to get that vaccine out within that year. But then that skepticism started, and that distrust of the health community, that distrust of the government, that all started. And I think part of that has to do with social media and being able to get that information, the misinformation and disinformation out on social media very quickly. And it's harder to counter that because it's hard to counter a negative, and it's hard as a physician to say, we live in a gray area. They're putting things in black and white areas, and people listen to that. And unfortunately, that's where that misinformation came from. That's an ongoing battle.
It's hard to believe in 2020, all we wanted was a vaccine, and today most people don't get the vaccine. It's kind of mind-blowing.
And what it is people get more scared of the disease than the vaccine. In this case, that's flipped a little bit.
It's flipped, totally.
Right. All right, Dr. Torres, thank you so much. Good to see you.
Great to have you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.